This is a case of a young girl with a very large osteosarcoma of the left femur. The mass is plainly evident on clinical exam and on x-rays. Osteosarcoma is an aggressive malignant bone tumor. It is most commonly encountered in children, but can be seen at any age. The treatment consists of chemotherapy to control presumed microscopic metastases and to treat the primary tumor. Surgery is then required to resect the tumor with negative margins. While limb salvage surgery is the most favored approach, there were some serious reservations about whether that could be accomplished without some form of an amputation. Limb salvage surgery can be accomplished typically with allograft or prosthesis, but requires the neurovascular bundle to be free of the tumor, which initially did not seem to be the case. Fortunately, with giving the chemotherapy, the tumor responded to the point where we were able to consider this a viable option. The X-ray demonstrated increased mineralization, which is typically a good response to treatment, and the MRI demonstrated the mass shrunk quite a bit. The arrow demonstrates the extent of the tumor within the marrow, so I needed to get above that with the resection. Because she is so young, the growth remaining in that leg needed to be accounted for in the surgical plan. Therefore, a team designed a customized prosthesis that has the capability of expanding. This was designed to fix onto her remaining small amount of bone with a coating that would allow for growth of the bone onto and into the prosthesis. Additionally, by preserving this bone, we preserved hip abductor attachments, which will greatly improve stability and function, and also allow the femoral head to grow, which will allow for normal acetabular development. In the photo, it is evident how much her leg has improved with chemotherapy. The dissection then carefully went around all of the tumor, preserving the critical structures. Specimen was removed and the split in the pathology lab to confirm we were safely above the tumor in the bone marrow. The custom prosthesis was then assembled. 6 months after surgery, it was time to lengthen the prosthesis, which is done comfortably in the office with a non-invasive magnetic device. The prosthesis lengthens by turning the magnetic ring inside and expanding 1 millimeter every 4 minutes. This can be confirmed by X-ray. She's fortunately making a pretty incredible recovery.